Okay, what I'm going to show you right now is how to position your baby for the cross-cradle breastfeeding hold. This position can be really useful for mothers who have nipple pain or who feel like their baby isn't latching very well or very effectively. So the first part of the position is to make sure that you have your baby nice and high. What I have here is just a regular pillow and then a breastfeeding pillow. And it doesn't matter what you use, you don't need a special breastfeeding pillow, but you'd like something nice and high like this so you can see the baby really is right up at the level of my breasts. Now, what we're going to position first is actually we're going to make sure the baby's tummy is towards my tummy. That gives babies a sense of stability when their tummy has a little bit of pressure on it. And then we're going to actually position the baby's bottom first. So the first part is I'm going to take my other breast, not the breast I'm going to feed off of, but the other one, and lift it up and put the baby's hips right underneath that breast. Then I'm going to bring my arm around and have my elbow here so that the baby's bottom is right in the crook of my elbow here. So we have this elbow butt breast kind of line here. And you're going to want to hold your baby fairly firmly. You don't need to worry about really hurting them. They were held so tightly in the womb before they were born. This kind of, firm touch feels good to them. So the next part we're going to position is then holding on to the baby's head. Now, what you want to do is take your hand either like this or like this, somehow so that you've got a thumb kind of on one side below the baby's ear and your other fingers kind of on the other side below your baby's other ear, so that your baby can move his or her head freely. You see, I'm not going to be pushing the baby's head. The baby's going to be able to move her head freely, but she does have the support here. Okay, so now that you've got your baby positioned like this, one question that comes up a lot is, what about the arms? A lot of young babies really use their hands a lot to try to get centered on the breast. And in this position, that can be a little bit difficult. So one thing that works for a lot of moms is to take this arm and kind of just get it down. You might be able to even kind of put it in the little nook of the pillow here, or use your fingers to some of your fingers to kind of just hold it into your body right here under your breast, so that the baby does get to touch your skin, but it's away from your breast. Now the other arm, some moms find that they can kind of tuck it under their other breast, and the baby will be able to pull it out easily, but it may give you a minute to just get that latch by holding this arm out of the way. Okay, so the next step is to hold the breast you're going to breastfeed from with a U position with your hand, kind of like this. So you put it under your breast and it's way back against your ribs. You're not going to be like smushing your breast or anything. You're going to hold it way back. And then you're going to put your nipple to the baby's nose and let your baby take the breast. Now the reason we let the nipple touch the nose is so that when the baby takes the breast, they're reaching up to take it, and then you can see the angle that the nipple will be at is pointed right at the roof of the mouth. And that's really important, to have your nipple up and at the back of your baby's mouth to keep it away from the baby's bottom gum line. Almost always when babies are damaging their mother's nipples, it's because the bottom gum line is somehow being allowed to rub on the nipple. So the best way to keep it from happening is to keep the nipple well away from the baby's gums and up at the roof of their mouth. Okay, so once your baby is latched on, if you feel a little bit of pain in your nipple, if you don't feel any pain, you're good to go. You're set with this position. Sometimes there's still a little bit of a pinch. And so what you can do next is squeeze your baby in from your forearm, kind of squeeze the baby's bottom in. And another thing you can do is kind of add more pressure to the shoulders here where your hand is. And I'm going to exaggerate this a bit. But if I push on the baby's back, can you see how the neck kind of, from this neutral position, how the neck kind of opens up a little bit, and it makes the baby look up even more. Now that's useful for a couple of reasons. It moves that nipple up to the roof of the mouth, and also if you think about how you would drink from a glass, you would be more comfortable with your head tilted back a little bit. So this allows the baby to drink more effectively if their head can be in this kind of slightly tilted back drinking position. So that's why when you first latch your baby on in this position, if it's not perfectly comfortable, you can squeeze from the bottom, squeeze from the shoulders, and that will kind of open the baby's neck up. Now you shouldn't, hopefully you won't have to latch off and try again, because if this is the baby's mouth and this is your nipple, and the nipple ended up kind of further down, if you pull the baby around, do you see how the nipple moves to the roof of the mouth right here? If the nipple started down here and you move the baby, then the nipple moves to the roof of the mouth, and the baby is providing suction all the while, so the nipple will even get sucked in some more. Okay? So, something else to look for is when your baby's positioned, there should actually be 2 finger widths between the baby's chin and their chest if they're in that really good drinking position. So you can just see if 2 of your fingers would fit in between the baby's chin and the chest. You don't want them bent down like this. You want them open like this. Okay? Now, one thing is, if you have larger breasts, you may need to modify this position somewhat. If your breast is kind of, out here, then it's good if you can still give your baby that firm pressure, but you may end up kind of in a little bit more of a position like this if your breast is out here a little bit further. And if after that you still have nipple pain, then I think it would be good for you to get seen by somebody so that you can figure out what's going on and get it taken care of.